Well, joining us to talk about the local impact of this nationwide spike that's now prompting a whole slew of states to hit pause on their reopening plans is Florida State Representative Ray Rodriguez and Texas State Senator Nathan Johnson. Both Florida and Texas seeing what health experts are calling alarming spikes in case numbers. So, gentlemen, thanks for joining us on this Saturday. Nathan, you bet. Nathan, I want to go to you first. You said when it comes to the state of Texas, the state didn't reopen too late. The state got ready for the virus too late. What do you mean by that exactly?
Well, I mean, we're going to have a big debate about whether or not we opened too early, and it's kind of an unanswerable question. What we know is that the shutdown was crushing our economy. That's not good for us in any respect whatsoever. But what we could have done is gotten ready sooner. We were late to ramp up testing. We're finally where we need to be. We still aren't anywhere close to where we need to be in terms of contact tracing. And the population of Texas is still receiving inconsistent, unclear messages and hasn't really have been able to understand the level of individual personal responsibility that's due here. You know, we're wondering if Uncle Google and Aunt Apple are going to save us, or the sunshine's going to save us, or the federal government. None of it is. This is going to take a concerted effort on the part of the state and on a part of every Texan to make sure that we can have our economy humming without another crushing shutdown.
Yeah. So, Ray, Florida and Governor DeSantis's managing of the virus outbreak there has been a flashpoint for months across the country. At first he was roundly criticized for staying open too late. Then it turned out for quite a while there, Florida's trajectory looked good compared to other states. Now it looks like it's spiking again. What's your assessment of what's happening on the ground?
Well, I think it's important to put the spike into context. While it is true that we've had more positive cases and the rate of positive cases has increased, if you look at how many require hospitalization, that rate has remained constant. If you look at those who are hospitalized, how many of those require intensive care unit treatment, that is flat and declining. And if you look at the death rate, that also is declining. So we have to put context. While there are more people who are testing positive, that is being driven in Florida by young people who are mainly asymptomatic. However, we are reacting to that. Yesterday, we closed down bars because it was clear that the social distancing effort in those areas were not working. So we're taking the steps to move forward, but the answer is not to shut down the economy again. We have to balance both the health of our citizens and the health of our economy.
And Jillian, if I want to build on that.
Go ahead, Ray. Go ahead, Nathan, sorry.
Ray said something I think is very important about the context, and that it is young people. At the same time, we also have to think about the fact that if you're sitting in a canoe and it's filling with water, the fact that it hasn't gone under yet does not mean that you're okay. We're not okay. We've still got hospital and ICU capacity, but that kind of capacity is also local. A hospital bed in Lufkin is not going to help me in Dallas, and we've got to look at trends too. Right. We've got to make sure that we stop this right now.
Yeah, it's a good point. One of the reasons I wanted to have you on is because you talk a lot about personal responsibility. To look at the bright side here, not just Florida and Texas, but the entire nation's in a better position now vis-a-vis a few months ago, just by virtue of the fact that we ordinary Americans who aren't public health officials or medical professionals know so much more about how to protect ourselves.
It is really helpful, and it allows people to do the kinds of things that Floridians, Texans, and everybody throughout the nation, if people understand, they're going to act responsibly. I just think there's been a lack of understanding and some sort of hyper-politicization of this issue, which is completely unnecessary. Yeah. But we're going to hit the point where even if we don't have a great contact tracing, I hope we get there soon, we can do this ourselves. When somebody on my staff tested positive for coronavirus, she immediately contacted everybody who she had been close to. We do need to do this on our own in addition to the efforts of the state.
Yeah. Important point. Well, gentlemen, we've got to leave it there. Unfortunately, we are out of time. But thank you for taking the time to talk to us today, giving us some insight to what's going on in these two states that are in the hot seat now. We will have you both back. Thank you so much.
Thank you very much.
Thank you.